A number of new diets are soaring in popularity nowadays. Flexitarian, the Keto diet, PALEO diet, and more. There's a lot of pressure, of course, to slim down during the summer swimsuit season. It can be difficult, though, to navigate it all. Which ones are real? Which ones are trendy? Which ones should be chucked in the trash? To give us some insight on all of this, CTV's medical consultant, Dr. Marla Shapiro, here in studio. Good morning to you.
Good morning.
Let's start with being a flexitarian. What does that mean exactly?
So I think the take-home point I'm going to give you before we talk about specifics is that when you look at a diet, ask yourself, are you looking for a lifestyle, a way that you're going to be able to incorporate what your goals are in eating and keep it going? And would you offer this to your child? Because the answer is if you wouldn't offer this to your child, it's probably not anything you should be doing. And when we talk about diets, most people think about something restrictive, short-term, going to lose their weight. In that case, you're going to gain it back. As a physician, when we talk about nutrition and diet, we're talking about lifestyle and a way of eating that's going to meet long-term health goals. So that's the difference here. So we look, for example, people who are vegetarian. Usually it's based on their moral beliefs, their wanting to be green, how they feel about eating animals. And most vegetarians eat quite appropriately, getting their protein sources from vegetarian sources. So in lots of ways that you can make sure your full nutrients are, although we have a lot of vegetarians who in fact have issues with weight because they eat a lot of empty carbohydrates.
True.
Moving on to this new term, flexitarian. Yeah, flexitarian.
So does that mean you're flexible?
No rules here. So essentially what this means is this whole movement that we're seeing right now, we see about 15% decrease overall in red meat intake pretty much globally as a trend. And in terms of flexitarians, what they're looking at, it's the concept of let's have less meat, less poultry, less dairy, but not necessarily none. It's based on more vegetables, more whole grains, more beans, nuts and seeds. And I think that generally is a healthy way to eat. It's sort of a spin a little bit on the Mediterranean diet, which we know has proven health benefits. So flexitarian, no firm rules, but the desire to get away from processed food and a lot of red meat, but not necessarily never.
We were also talking about the keto diet. Now,
Keto,
what's that?
very hard diet, nothing I would ever endorse long term. And we see a lot of athletes trying this. Very difficult to stick with this. This is low carb or almost no carb, high fat diet. The concept is that you want to turn your metabolism away from burning carbohydrates and burning fat, so it removes almost all carbs and sugars, and it promotes quite a bit of high fat, as you can see, the animal fat, butter, olive, and coconut oil. And the idea here is that if you're burning fat, you're making ketones, and that's going to cause increased weight loss. Very difficult to sustain long-term, hard for me to endorse a diet that has no vegetables at all and none of the cancer-fighting properties that we know cruciferous vegetables have, and the importance of having a balanced diet, no grains at all. Very difficult to sustain that. You do see some athletes doing this because it helps them to increase their lean body mass. They feel that they've got more endurance. The longer you're on it, some people will tell you that they get a little mental confusion associated with it. So it is a short-term approach for weight loss usually, and specific goals, but nothing we endorse long term.
Last one, paleo.
So the paleo diet is sort of the caveman diet, and that's getting back to our caveman ancestors, and it's looking at having meat and fish is included. It does thankfully include vegetables and fruits, but it excludes dairy, grains, and legumes, and that's difficult to endorse as well. It excludes processed foods. I'm A-OK with that. So this, again, a diet that is leaving out major food groups can be very difficult to endorse. Look, if you want to do a short-term fix, remember it's a short-term fix, but if it doesn't teach you how to eat properly with appropriate portion sizes, incorporating lifestyle and exercise, it becomes a vicious circle.
And the cavemen only lived to be 30.
That is a good point that I won't comment on.
Great to have you here. Good morning to you.
Good morning
Thank
to
you
you
for this.